everyone, and welcome to another episode of Ask the Doc. I am your host, Jennifer Filzen, and I have with me Kevin Pereau of TranscendIT Health. Welcome, Kevin.
Hey, thanks for having me. Pleasure to be here.
Oh, I'm so happy to chat with you. So we've been talking a little bit before the show started, and I want you to share with everybody the amazing things that you're doing at TranscendIT Health. And please help me because your name, and explain the name. It's got the IT in it, so please explain that.
Yeah, that's the marketing genius of Kevin, and everybody that's ever worked with Kevin would tell you that I'm not a marketing genius. But the TranscendIT, the IT is capped because it stands for information technology. So our company really focuses on stoking innovation for the healthcare industry. That can be an app, that can be a platform, that can be a coaching service, that can be meals delivered to your house. But the industry has finally caught up to the notion that keeping people healthy is the best way to lower the cost of healthcare. So that's the story of TranscendIT Health. We do strategy and we do management consulting. We started with innovators, but as the industry changed, the digital health industry is probably about 10 years old now. Our engagements have kind of come upstream. We're focusing on larger clients now, health plans wanting to connect to innovators so that they can put these solutions that can help people into the hands of those who need them the most when they need them the most.
That is wonderful. And I would imagine that digital health and all the different things that go along with it really took off thanks to COVID and our inabilities to see each other in person. Like, I know that recently I have had to see my own doctor to discuss my blood work, and we did it online, which I thought was fantastic. So tell us a little bit about some of the ways that you are using digital information to help your clients.
Sure, fair enough. I think COVID has, for better or for worse, been a big driver. But to get a clear picture of digital health, it's actually been around for about 10 years now. I think with the dawn of the ACA, what happened was investors realized that things are changing in healthcare. We're transitioning from a model where we would pay the doctor every time we went to see him to we would pay the doctor for delivering us a better result. And that's called value-based care. And I think President Obama ushered that in back when the ACA was first introduced. So I think what we found is that the drivers have been many, and the telehealth segment of digital health really took off during COVID for the reasons that you just described. It wasn't safe to go into the doctor's office because that's where all the germs were, right? So I think what we learned was that there are a lot of things in healthcare that we can service without actually going in and seeing the doctor, which is good for your doctor and good for you. I mean, it makes the accessibility of care a lot easier to manage. And boy, for a single mom that lives at home with some children that aren't yet in school, that can be huge, right? I mean, you don't want to deny care and access to care to people just because they can't get to or from a doctor. So I think COVID was a big driver for telehealth. But I always messaged digital health this way. I think the first era or the digital health 1.0 phase was probably around 2011 to 2014. And that was a big app explosion. And I think we learned a lot about people and the technology that they're willing to use. And we exploded a lot of myths about whether or not people will engage or be held accountable for their health. That kind of paved way to Digital Health 2.0, which was the big data era, a device for everything. You'll sometimes hear this referred to as quantified health. And now we're on the cusp of what I call connected health, which in my opinion is the most exciting time that we've ever seen in healthcare, which is, okay, we are now using devices. We're tracking all of our biometrics and the effects that the things that we do and how we eat and how we sleep affect our overall health, to the point where we can capture the data, analyze the drivers or the triggers, and then take that and reconnect us with assets that can help us better manage our triggers. So Digital Health 1.0, Digital Health 2.0, Digital Health 3.0, And I think what you mentioned is a good driver for a segment that literally we thought would take off initially, but did not, which was telehealth. I think people are now really just sort of warming up to telehealth and accepting it as another way of delivering care when we need it, where we need it.
Oh yeah. And you sharing those stories about the apps and the big data, I usually ask my guest some success stories, but as you were talking, I thought of a success story of my own. We have a very dear friend. We call him our adopted daddy. He's 90 years old and he's a neighbor of ours that we've known for years. We adore him. And, he is a very, very healthy 90-year-old. And part of the reason is he loves technology and he's got all the cool apps on his iWatch, right? Apple Watch. And it, of course, there we go. We're all getting one. Yep. And so he's monitoring his sleep. He's monitoring his blood pressure. He's monitoring his heart rate. He's an avid walker. So he walks about 7 miles a day. Yes, at 90 years old. And he's very physically fit and he's tracking all of his blood sugar. Like he's doing all kinds of things and he's doing it through the apps. And he also takes all of his data, puts it on a thumb drive. So when he goes and sees a brand new doctor, they have his entire medical history because he has been able to track it all. Isn't that amazing? But, we have to wrap this up, Kevin. But boy, if we want to find you, how do we find you?
Well, we do have a website. We're available at www.transcendit.health. We're not a .comer. We're a .health. And I'm on Twitter. I'm at K Pereau. I'm on LinkedIn. We have become the digital health whisperer. So if you literally know anybody that's trying to get an idea launched or off the ground, we're good at helping them get funded and then connecting them to the channels that can help take them to market. And we're in it to make sure that healthcare gets to a better place, right? I mean, I mentioned ROI earlier. We define ROI as getting the patient, the member, the consumer to a better outcome. That's our whole mission in life.
That is fantastic. Well, everybody, that's it for today. Thank you so much for joining us on Ask the Doc. And thank you, Kevin, for joining us. If you want to learn more about what he's doing at TranscendIT Health, please go to Buzz TV at iwannabuzz.com to learn more. But thank you so very much. And we'll see you next time. Bye.